All right, so this is our podcast. I'm with Dr. Tom Giammatteo, chiropractor, naturopath, co-developer of Integrative Manual Therapy. My name is Ralph Havens, physical therapist and certified in Integrative Manual Therapy. And we're here to talk about kidneys and something called summer school for all you healthcare practitioners, and some thoughts around healing and kidneys that you might not have considered. So Tom, welcome. Always good to see you.
Hi, Ralph. How are you?
Oh, really good, really good. And so I was getting ready for this podcast and thinking about it, and I thought, you have a way, the integrative manual therapy approach to help somebody with their healing. And we always talk about we're not healing somebody, we're not making we're helping the host, which is like helping the person get healthy, and then ultimately the person is that heals. It's not like we do a healing to somebody. It's more like we set up the situation and improve the structure so that somebody can then heal. And so when we think about kidneys, just so that all the people that are looking at this, we get all sorts of messages on our Facebook and YouTube from time to time about you can't say that. And so I just want to clarify, it's about helping people get healthier. And then ultimately, we believe the body is what heals. God heals, spirit heals, the body heals, and we take away stuff that's in the way of that. So when we think about kidneys, I was thinking, what are the kind of conditions that people might have, and maybe they don't even know it's a quote unquote kidney problem in your eyes, but they come in with certain types of conditions. What are things that you tend to see, and then it might be a issue that you want to get them healthier in the kidney area.
Yeah, so let me take a step back. The Connecticut School of Integrative Manual Therapy has been around for 23 years, and we have a 12-week program that addresses structures of the body, and we do a structural medicine. And we have courses on GI, men's and women's health, endocrine system, traumatic brain injury, and post-traumatic stress pieces, and all of them have a chapter on the function of the kidneys. As in traditional medicine, they filter out toxins in the body, and we generally they go through the kidneys, they go down the bladder, and we use our urination or peeing to get them out of the body. So some urogenital, ureters, meaning the urine flow system, is thought of in traditional medicine of even having kidney stones, a ruptured ureter, bladder infections called urinary tract infections, and also another common one that's in traditional medicine is cystitis, where that's inflammation of the bladder. And then in men, it's prostatitis and prostate cancer. So it's a really big, important system on our detox system. We have two ways of getting poisons out of our body. And the ones that are water soluble come out the kidneys. And the ones that are not water soluble come out the liver through putting it back into the GI system. And we have a bowel movement in that process there. So we never really have had a urogenital. We do have one course called urogenital, talking about the drainage of the urine, and plus the men's and women's health issues that relate around the same system. And what I've been doing since my wife passed away in 2015 is reconstructing the old material and bringing in brilliant new material in this new generation of research to help all those systems. So this summer school, we are doing a presentation on kidney and renal function. And besides what we just talked about for diseases that happen on that piece, another one is bedwetting, called night uresis, and frequent urination and incontinence, which means you can't hold your bladder anymore. Those are the things that people usually think about kidneys and urinary tract system along those ways. But in Chinese medicine, 6,000 years ago, there's actually a meridian channel called kidney. And it is also related to the emotions of fear. And Fear is a very strong emotional response besides anger and love and kindness in that whole area. So this course incorporates Eastern medicine and Western medicine, that, you know, your fear can actually seize the kidney up and it can actually get an infection secondary to that. So we're going to the mind body connection to those pieces at the same time. And I probably have in our other courses, all the kidney classes, there's probably about 200 to 300 pages of techniques from the old information that we wrote in multiple books and things that I'm going to accumulate together. And then we have a new model, which is since 2015, based off the Golden Heart Resonance. And inside our heart, there's actually a vibration that is not found on EKGs or in traditional medicine. But if you go back to Chinese literature and Ayurvedic literature from India, they've talked about these rhythms before. Okay, so we're inundated in this United States that Western traditional medicine is the scientific medicine, but people for 6,000 years have been using acupuncture and Ayurvedic medicine to heal too. And I feel that our scientific techniques of Western medicine haven't been smart enough to prove these other phenomena that have been kept in many cultures over many years are true, but we don't have the science to prove it. And
Yeah.
almost today, science is almost a religion. Like, show me a scientific paper from, you know, American Medical Journal or something like that. If it's not there, it's unbelievable. But, you know, there have been healings that have been successful in cultures around the world that got us to here where we are today. So,
Yeah. And, you know, the first class I took from you guys was men's and women's health issues in February of 2000. And I remember I didn't think I had any kidney issues or any things like that. I had severe anxiety, but I was trying my best to hide it. But
right.
What I remembered about that class was you taught us real specific techniques for the kidneys and the ureters, the little tubes that go to the bladder and all these other techniques. And me and my therapist that were working with me at the time from our clinic, we went there and we were doing these techniques. We didn't even know if we were doing them right. They're very intricate. And what I remember after that was that week when I was running, my pelvis and my body, I just felt really, really good. Like I was my stride was better, my function was way better. And I remember partway through the class, I just talked to Sharon and you and we started figuring out a plan to get you guys out to San Diego, and you guys came to my clinic. You know, you and your team starting then like 3, 4, 5 times a year. And then I went to wherever you guys were for
Right.
many years to learn this stuff. So it's like, you think, you know, you've got this, you know, some of the conditions you talked about, and okay, well, let's go see what Tom says or Ralph, or, you know, we got practitioners all over the place. We talked about some great ones in Portland, Oregon. And it's like, we might land on the kidneys and say, well, let's heal that up. But it could be even stuff that doesn't seem at all like a medical diagnosis like that. I mean, it literally improved my running when my pelvis got better. So, how do you, I mean, you're a chiropractor and a naturopath and IMT, and the conditions you described are like medical related. I guess it might be the reason our podcast is called When Doctors Have No Answers, or I should say when the doctors you've been seeing have no answers. There's an alternative approach. Anything else you want to say about the kidneys in general, since summer school is coming up with the kidneys? And if you want that information, reach out to us. I'll put the links below, imtwellnesscenter.com and my link, ralphhavens.com, and we can direct you to that if you're a practitioner or you're interested in this. But yeah, tell us more about the kidneys. This is an interesting phenomenon.
So when we were doing our biomechanics and back class, we always talked about, Ralph, that, you know, because we were a physical therapist, a classic low back pain patient would come in 3 different flavors, right? They'd come in with pain right at the belt line in the center portion, and then they would come in with pain in the SI joint, which is over the pocket area, or they would come in with sciatic pain down the leg type of thing. And then you'd have a group of patients that would come in that it wasn't in the center and it was above the belt line, about 2 or 3 inches up and over to the side. And they'd point, no, it's not in the middle of my back. It's always on the side of the back. And in our techniques, it's a 2-minute fix, and then they never have the back pain anymore. And we call that the ureter tear, right? So
Oh,
we
yeah.
have, right, we have the kidneys sitting up in the mid back, right below the brow line, and they connect to the bladder by a small, thin pipe, almost vein material that goes down about 3 inches from midline on both sides, and they track down the back, and they go right into the SI joints. And our palpation skills, you can actually feel like it's a wet straw that's got torn, and that's the site of the disruption of membrane. And we would do our simple disruption of membrane, and all the range of motion would come back, and all the muscle spasm would go away. And one of the principles of integrated manual therapy is, and of osteopathic medicine is, the fluids have to stay in their containers. And if they don't stay in the containers, the body is going to try to get it there as much as possible. So what that means is if you have a torn artery, if you have a torn vein, or if you have a torn nerve, or if you have a torn ureter, and the liquids are coming out and they're going into your back, you get muscle guarding because of that piece.
Yeah.
And we have a classical myofascial release technique that we invented called disruption of membranes, and we can physically lightly torque the body in certain positions so those seal up, and apparently the structure of the vessel gets repaired immediately at that point, and then the symptoms go away. And it's not a muscle, it's not a multifida, it's not a psoas spasm and everything else. And those guys do kick up and they stay there. So, most traditional physical therapists or massage therapists will go in and do a deep massage on the psoas muscle, and the person walks out, and 5 minutes or 3 days later, the psoas spasm's back. And what we learned in integrated manual therapy, if you relax the muscle and it comes back again, and that muscle is doing its job, we have to go deeper. And that's why I feel that got you attracted to this work, is that we kept not being satisfied. Well, that should have worked, and it's the patient's problem. And we were really discovering deeper tissue responses, that if we fix those, then the muscle relaxes and the flexibility comes back overall.
Yeah, we call it the hierarchy of protection. Like the body will protect you, it'll spasm a muscle, or there might be a joint that has a problem, but if it keeps coming back, that's not possibly the problem. It's like it's protecting something that's more important. Like a ureter is way more important than a little muscle or a joint, but the body will use that. I was working on my mother-in-law actually a couple of days ago, and I was doing the disruption of membrane technique all around her pelvis. And she goes, "Oh, are you trying to stretch it? Or are you putting some pressure on the muscle?" And so I explained this whole principle of how the colon can be also having a problem with its membrane wall integrity, sort of leaking. And what the body can do is try to stick it to the pelvis so that it has a wall. And so we could keep seeing a tight SI joint, tight hip, back stuff, muscles, all sorts of spasms. But we were doing the disruption of membrane technique to, I don't know how you say it, like fix up a hole sounds extreme, but basically restore the integrity of this. And it worked pretty quickly. It's the way you guys found it. I think I got the story right. But how did you guys figure out that you could work on a colon? Like your chiropractors, massage therapists, physical therapists, how did that happen?
Well, we took Giampattio's visceral manipulation for years, and we were actually instructors of that for a while. And then after we got married, I had a teaching engagement in Hong Kong, and we got to work with the British trained Hong Kong physical therapists that were, their ethnic ability was more Asian. And when we went to feel their GI system, it actually felt like there was muscle tone, and it almost felt like they had a big piece of kielbasa in the GI system, where America, it feels just like a bowl of gelatin in there. And they had structure and muscle integrity because they ate fresh greens every day. They had green tea. They never used refrigeration. They never had a processed food in their life. And you really felt this full muscular wall, which is supposed to be our GI systems. And so we started to get good ones and bad ones, and we noticed there was little dimples in it, and we were trying to figure out how to get the muscle spasm out. And we discovered 3-planar fascial release in a specific order, that we feel actually goes and syncs up the phospholipid membrane to the cell membrane. And some of our students, a couple of them were astrophysicists, and they were saying, well, if you go down to the cellular structure, this is when you do this pressure, it seems to realign those so the membranes actually reconnect again.
Yeah, it almost seems like they're little magnets that just go.
Yeah,
Now they're all set up. It's really amazing. Bone bruise technique is another one that's just like incredible how fast it can work. My little boy loves me to work on his bone bruises before races. And his straight leg raise goes from a little tight to really loose, and his stride is wide open. And we just fixed up bone bruises. And I remember when Jen was pregnant with the other guy, you kept showing me where the bone bruises were, and I did bone bruises, and Jen had, it was the best delivery ever. So it's really amazing. Yeah, so kidneys.
So the kidney system will go from the structures of all those organs, the disease and the infectious process of all those organs, and then moving into the energetic, emotional Eastern philosophies of flow of the kidney meridian and the bladder meridian, and how responsible those are into reconnecting the whole system.
Yeah, and so summer school is starting in coming up
August 3rd, which should be a Saturday.
Yeah, it is a Saturday, 3rd through the 5th. And if you're a practitioner and you want to venture over to West Hartford, Connecticut, would somebody need, could this be an entry-level class to somebody that's a manual therapist of some sort, a massage therapist, a chiropractor, or is it more like you got to take some beginning IMT?
Unfortunately, this is going to be, so anybody that's been related to the school and has 2 or 3 classes is always invited, and we can see if they have the skill set to understand. But the book I'm writing is over 600 pages long, and we'll need the proficiency in some of the basic tools.
The class has to flow along. So,
Yeah.
but if you're interested, IMT, that stands for Integrative Manual Therapy, IMTwellnesscenter.com to contact Tom and get on his email list. And he does do weekly Zoom calls for some practitioners, and you can start to go down the road of learning this wonderful, amazing method. It's what I use for myself and my family and my clients. And it's literally saved my life. I would consider that as a true statement. Like, it's definitely gotten me way better than I would have been without it over the years. And
Ralph, I've been invited this fall to start to teach. I'm going to be at the National American Massage Therapy Association in Tampa, teaching at the national level there. And then for the American Physical Therapy Association, I'm going to be teaching for the Council of New Hampshire, Massachusetts, Connecticut, and Vermont, re-educating people, because in the 90s, everybody was interested in these things, and my wife passed away, so we've been quiet for a number of years. So I'm going to go back and reintroduce IMT to those professions too.
Yeah, and that's one of the wonderful things. It's like there's no you have to be a chiropractor or a physical therapist or some degree. It's like basically even moms have come into this world and then developed really nice practices, and their goal was just to fix up their kids of stuff that doctors didn't have answers for yet. So reach out to Tom, IMTwellnesscenter.com. Reach out to me on the West Coast, RalphHavens.com.
The last piece is the school is starting August 21st. There's a 3-day program, and then another 4-day program from August 21st to the 23rd is learning our myofascial release techniques. And then the 24th to the 27th of August is the myofascial mapping. And it's the first week of the 1-week program of 12 processes of becoming an IMT practitioner.
That's awesome. And myofascial mapping is so wonderful because you can find where to go work. Like, somebody comes in with a bunch of stuff that people haven't been able to have answers for. You could say, oh, it's because there's a problem in this part of the body, and this is the thing they're protecting themselves from, and then pull from the information and do something to that area, and then retest and see the difference. So if your clients, if your patients haven't been, if you want to get to the next level for the more complex ones, or you want faster results, or if you yourself have some problems and issues that haven't been resolved, reach out to us and we'll hook you up with a way to connect up with integrative manual therapy. So thank you, Tom. It's always a pleasure, man. And it's just amazingly cool how things are going. So,
Yeah.
any parting words?
No, it's been a hot summer and I hope everybody stays healthy. We're going into crazy election season and Mercury
Right, here,
retrograde
here.
coming up. So
Yeah,
just be careful out there and try to stay
yeah,
stable.
yeah. That's awesome. Okay. All right, Tom. Awesome. I'm gonna click everything off here. And